This video is the first of a set of 4. All 4 videos are about shared decision making in case of multiple and complex health problems. In this first video, you will find a general introduction concerning this topic. We will show you that shared decision making is more than just rationally exchanging information, especially in case of complexity or chronic diseases. Shared decision-making also demands attention on a physical, emotional, relational and contextual level. We believe that all these aspects should be taken into account in shared decision-making in complex care. This presentation is about creating optimal conditions for shared decision-making so other instruments such as decision aids can be used in the best way. Often people associate shared decision-making with the moment of choosing the best suitable treatment option given a certain diagnosis. During the whole patient journey, however, it gives many more decision moments. Sometimes you need, so to speak, a magnifying glass to zoom into some specific details. Then again, you need a helicopter view to oversee every aspect involved and their interdependency and their connections. Every time you do so, you cooperate as a professional with the patient and their next of kin. The picture you see belongs to the so-called dialogue model, an evidence-based, universal usable method to support shared decision-making in complex care in an integrative way. It helps with zooming in and out using a visualized dialogue. In another video, we will explain how this works. A third video will show you an example of how this model can be used in medical care, and another one is about the use of it in mental health care. Links to these presentations are available at the end of this video. Let's get started. Not that long ago, the medical model prevailed in healthcare. The professional judgment and advice were dominant. The patient played a passive and reactive role. Maybe this cartoon exaggerated it a little bit, but this is actually showing the way it used to be. Doctor knows best. Over the last years, decision-making is becoming a more balanced process. Some even overshoot into the opposite, called informed choice. You ask, we deliver. It was thought that patients themselves could make the right decision if only the professional would provide them with understandable information about possible options. The professional would perform likewise. The patient in this cartoon expresses the doubt that many had concerning this approach. Shared decision-making mostly varies between these two opposites. All participants contribute to the decision-making process depending on their needs and their possibilities. Of course, it is possible that mainly the professional or mainly the patient decides what to do, but in shared decision-making, they all agree upon this outcome. If patients and professionals inform each other adequately and participate in an active way, the quality of care is believed to increase. Together, they make the best fitting choices. Shared decision-making supposes that patients and professionals have equally important knowledge to contribute, though both on different areas, personal and professional issues. Professionals can properly respond to the personal needs, preferences, values and context, and patients have more information about the benefits and the costs of several interventions. The shared decision-making process also helps patients to clarify what matters most to them. This picture shows that all these aspects come together in shared decision-making: professional and personal skills and expertise, personal goals, preferences, and using an integrated biological, psychological, and contextual approach. In singular health problems such as a broken leg or spider phobia, shared decision-making is not that difficult. A complaint-oriented approach is mostly sufficient. Most often it's clear which interventions are needed, and the patient can undergo the treatment in a quite passive way, or just little effort is wanted. It is quite different in case of more complicated health issues, such as a stroke or a lot of mental health problems. Then, as a professional, you want to focus on more than just the symptoms presented. You will broaden your scope and will try to understand the unique personal situation. These problems are often multi-layered, and the analysis process is more complex. Often there will be more than one treatment option, and it will be necessary to match them with the personal preferences, values, needs, and circumstances of the patient's system. Often more personal contribution from the patient is needed. Think of lifestyle adjustments, performing practices, and taking medicines at the right time and for long enough. In daily life, this turns out to be not that easy. Understanding the reason why and taking part in the decision made helps to be and stay motivated. Further, in case of complex health issues, often more professionals are involved, and then careful coordination is needed. Over time, due to several developments, new analyses, decisions, and adaptations in the care given will be necessary. Schematically, the care process goes as follows. Before shared decision-making actually can take place, first a proper analysis is needed to determine about which items decision-making is necessary. Therefore, good information exchange is needed, and this takes more than certain cognitive and language abilities. Understandable language is key, but not enough. For instance, emotionally, the patient must be enough at ease, not too stressed, anxious, or depressed. Physically, the patient must be able to participate. Too much pain, nausea, or discomfort can interfere too much. To share personal issues, the patient must entrust himself to the professional. Proper attention to all these aspects, emotional, physical, and relational, is needed, just as clear information, well dosed and well timed. Involving next of kin and other caregivers can also improve the participation and the cooperation. Sometimes they even are mainly our conversation partner. The search you undertake together surely is aimed at shared understanding. What is the matter and what is needed? Shared understanding also means understanding each other. The last years, much attention has been given to establish better understandable professional information. Less technical jargon, more common language. and this surely is a positive trend. Professionals understanding the patient and his personal circumstances is just as important. Many patients indicate that being heard and seen by their therapist is most valuable to them. After this first shared understanding step, in which a proper overview and insight of complaints, symptoms, personal aspects, including the helping ones, and their coherence has been established, the second step can be taken, in which you, together with the patients, and if wanted other important persons, will look into the several care options and choose the best matched ones. The step of shared decision making. This is just like step 1, not a purely cognitive process. All aspects mentioned earlier are involved. Decisions are rarely rational. We make choices with our head and our heart in a more intuitive way. Emotional and relational aspects of the patient-professional interaction are key. If there is a good working alliance, patients are inclined to accept professional advice given, especially if the professional has taken into account all personal aspects. After the shared decision-making step, the third phase of shared care follows. Professionals, patient and other will contribute to the care needed. As already said, the more the patient participates in the whole process, the better the connection, the bigger the chance of good compliance. This cycle repeats itself whenever the care given is being evaluated because of new developments, unforeseen problems, or planned. Making a pause to reflect is worthwhile. Analyzing together the actual situation, what possibly has been changed, with new shared decisions are needed to go further in the right way. Let's summarize. We have argued that shared understanding precedes shared decision-making, followed by the phase of shared care, and that these steps are being repeated with every evaluation and decision moment during the whole care process. Furthermore, we have seen that cognitive, emotional, physical, and relational aspects all play an important role in shared decision-making in a coherent way. What is needed for shared decision-making may, so to say, be clear. How to accomplish this in a handy way in daily practice is another story. The dialogue model has been developed to achieve these goals. It supports professionals and patients in all these 3 steps on every level mentioned in a practical way. If you like to get more information about the dialogue model and its application, you can click on one of the following presentations. We advise to watch the explanatory presentation first. The other 2 give you an impression of how the dialogue model can be used in medical practice and in mental health care. Furthermore, you can find some information on our website dialoguemodel.com. Thank you for your kind attention.